Hello. Spasticity describes muscles that can be very stiff and difficult to move. If people who experience spasticity are not looked after correctly, they can develop painful joints and pressure sores. Positioning and moving people correctly can help improve their pain and reduce the risk of complications. When you are looking after someone who suffers with spasticity, there are a few key points to remember. Make sure that they are in a symmetrical position as much as possible. Make sure that they are comfortable. Try to position them so that stiff muscles are stretched, and make sure that they are in a position that enables them to do the things they enjoy. Remember that it is not normal for anyone to stay in one position for too long. If someone cannot move themselves, they will need to be moved regularly. Sometimes people will have spasticity that affects one side of their body. This is very common after stroke. If you are lying a person on their side, use a pillow to support their head and neck, and another pillow behind their back to stop them rolling over accidentally. Place their upper arm out in front of their body, with the elbow straightened and supported on another pillow. Finally, place their upper leg on pillows so that it is supported in a slightly bent position, with both their hip and knee bent. You will need to check their position regularly to make sure that they are still comfortable. If someone wishes to lie on their back, make sure you support their head with a pillow. If it is not possible to straighten their legs, make sure they are supported. If their knees pull together, use something soft to help keep them a little bit apart. Use support to prevent the legs adopting a windswept position. When positioning someone in a chair, ensure that their bottom is as far back in the chair as possible. Their hips, knees and ankles should all be at 90 degrees or as close to this as possible. If the trunk is not symmetrical, use a pillow to offer additional support. If the person cannot hold their head up straight, consider reclining the chair. Both feet should be placed flat on the floor or on the footplate of a wheelchair. Rolls and cushions can be used to support the legs if they pull out to the side. The affected arm should be supported on a pillow, some distance away from the body. Make sure you position the fingers and hands in a comfortable but stretched position. You can use a small, soft object such as a rolled flannel or a splint placed in the palm of their hand to help stretch the fingers and thumb.